Hello.
Hi.
Hi, welcome to Migraine Canada. We are here tonight on this beautiful snowy night um, with Migraine Canada and Rachel Luther, our guest for tonight. If you have just joined us, welcome. This is one of our webinars that is part of a series called Ask Your Pharmacist, and I'm very lucky and honored to have Rachel Luther, our guest pharmacist for tonight. Um, I met, I think I met you more than a year ago, Rachel. Was it a year
Mhm.
ago or more?
A year ago or more for sure.
So Rachel is one of our migraine pharmacy network pharmacists, and I think we became best friends because of the passion that you have
Hmm.
for people living with migraine and your continuous um, search for ways to help people living with migraine and your patients in general. Sleep is one of these things that we started talking about, and then you explained to me about this amazing program that you have. You are a registered pharmacist. You do have a pharmacy that is in Fergus. We're going to be giving the information on the pharmacy. It's Center Wellington Remedies RX that is in Fergus. Did I say Ferguson or did I say Fergus?
No, you said Fergus.
Okay. Rachel lives there with her husband and two children. When she's not in pharmacy, I've just found this very interesting information or a very interesting fact. She is out looking for mushrooms with her daughter on walks. And this is the first time I've heard of someone going and looking for mushrooms. Um, Alongside other things, you're very active in your community. You do help um, with fundraising. You told me about some of the fundraising activities that you do for your community. Welcome, Rachel. It's a pleasure to have you. I'm hoping that our guests tonight and our viewers tonight will enjoy this warm talk on a very cold night. Thank you
Perfect.
very much.
Thank you, Heba, for that introduction. So I'll just get our presentation up, and I might need some help with that.
Okay, let
There
me
it
see
is. It's just
what I
not
have.
as fast. There you go. All right. So tonight we're going to be talking about how to get a good night's sleep and a cognitive behavioral awareness program that I offer at Center Wellington Remedies RX. So you're probably here because at some point in time you found yourself lying awake trying to get to sleep and unable to get to sleep. So tonight, the purpose of our presentation is to kind of look at some sleep myths, define insomnia. We're going to discuss some predisposing, precipitating, and perpetuating factors for insomnia. And then we're going to look at how it relates to migraines, because that's why we're here at Migraine Canada live stream tonight. And then I'm going to outline what a sleep therapy program kind of looks like. So, one myth is that everybody needs 8 hours of sleep at least per night, and this is not really true. Some people may need more, some people may need less, but people's sleep needs are individualized based on them and maybe what's going on in their life as well. Another myth is awakening a few times per night is a real problem, when in fact it's quite normal to wake up 2 or 3 times a night just from normal ebbs and flows in your sleep patterns over the evening. Another myth is when sleep worsens with age, it signals a major problem. And this isn't the case. In fact, as cruel as it may seem, as you get older, you don't really need as much sleep as you did as when you were younger. So it's a funny joke that nature does on us. But when you get older, you don't need as much sleep, and it doesn't signal a major problem if you're not sleeping. Sometimes it could be just your body readjusting to how much sleep it needs. And the last myth is most people just want a pill to fix their insomnia. Studies show that most people just want to have their insomnia fixed, and if they can do it without a pill, they would prefer that. So, how is insomnia defined? It's a complaint or difficulty initiating or maintaining sleep. that can cause a significant impairment or distress in your functioning and is often associated with fatigue. It's defined as having 3 or more nights per week for 3 or more months. That would mean that it's a chronic sleep problem. Some predisposing things are things that you can't really change. There were cards that were dealt with you that predispose you to maybe having some poor sleep habits. Like it could be age, it could be that it runs in your family. There's some precipitating factors or things that can kind of bring it on. Like if you're the type of person who's anxious anyways, you're more likely to have some problem sleep. If you have a tendency to worry and have circular thinking, again, that can cause problems with having your mind running so that you're unable to turn it off to sleep. And just if you're generally a hyper person, you're going to have problems with sleep. There are some things that can perpetuate having sleep problems, like if you're going through a stressful time in your life, if you have not a very good routine when you're going to bed, if you work shift work, it's likely that you're going to have problems with sleep. And then there's some things that you could have going on medically, like chronic pain and anxiety and depression, that can really not help, can really affect the quality and quantity of the sleep that you're getting. So, how does this all relate back to migraines, which is why we're here? It's kind of like a chicken or egg type thing. Sometimes when you treat migraines, you may find that your insomnia changes because you probably can't sleep because you have a migraine, and that's going to contribute to your insomnia. So if you treat the migraine, that in turn may help with your insomnia. And then the flip side of that, if you suffer from insomnia, you have an increased risk of developing migraine, an increase in migraine frequency, an increase in pain intensity, and an increase on the impact that your migraines have. So if you treat the insomnia, then that can help with how many migraines you're getting. Yes, Heba.
So I saw this presentation ahead of time, and when I saw this slide, the first thing I think of um, is it possible that insomnia itself is one of the symptoms, is one of the things that are caused by migraine? Do we
Yeah,
know?
yeah, like a chicken and or egg. So like if you treat then the migraine, then that in turn will affect and maybe take care of the insomnia.
Does that mean that it is still within our control if it's part of the syndrome itself or of the condition itself, that we are able to still interfere with insomnia or with interruptions or with sleep disruptions that happen with migraine, you think?
It depends on if the sleep is secondary, if your sleep problems are secondary to a migraine. So then if you treat the migraine, you in turn will help with the insomnia. But if you have insomnia and that's your primary thing that's going on, and then when you really have poor problem sleeping, you get a migraine as a result of that, then treating the insomnia will in turn take care of the migraine. It's kind of like if you think about somebody having a lot of tension in through their neck. If you treat the tension in their neck, then you're going to improve the migraine.
Yes.
And then if you have a migraine and you treat that migraine, then the sensations of the pain that you feel in your neck are going to get better because you're not having your body so, kind of wound up. Because your perception of pain changes when you're in pain and then also when you don't have enough sleep.
Is it possible also that the whole idea of fix your sleep and your migraine is going to be better is easier said than done for people living with migraine? Because most of my patients come in and say, yeah, I do have issues with migraine, but with sleep, but this has been ongoing for years, and
Mm-hmm.
the worse my migraine is, the more difficult it is for me to control my sleep.
Mm-hmm. Mm-hmm.
So is there a correlation between also how bad the migraine is or how frequent your migraine attacks are and how bad your sleep is?
Mm-hmm. Yeah, definitely. It feeds into each other, right? It's almost like a positive feedback loop. So if you're having like migraines, then it's going to, well, I guess negative, but it's going to decrease your sleep, right? So they kind of go hand in hand. And depending, like, If you find that treating your migraines for years have not really helped your insomnia, then you may very well benefit from trying to go after the insomnia. Um, Again, if you find that your migraines is what's keeping you up at night, then you may very well find that instead of worrying about your insomnia, treating your migraines is going to help in turn your insomnia.
Perfect. Thank you very much. Thank you.
Yeah. All right. So, what is a sleep therapy program? So, a sleep therapy program basically has four pillars: sleep restriction, stimulus control, cognitive restructuring, and relaxation training. Here are some steps that can help with a solid night's sleep. It's important to go to bed only when you're sleepy and not before your threshold bedtime. And it's important to maintain a regular threshold rise time in the morning. Another important thing that you've probably have heard at some point in time, if anybody who has problems with sleep have heard, that you should only use your bed for sleeping or sexual activity. It's important to make sure that you associate your bed with sleep and you not watch any television or use electronic devices or eat or read in bed, because we want our mind and body and our brain to think bed, sleep, or sexual activity. If you find that you're unable to get to sleep or fall asleep within 10 to 15 minutes, don't lay there and toss and turn for hours on end. Just get up and return to bed when you're sleepy, and do this as many times as you want. And the whole point of that is to make sure that your bed isn't associated with any type of anxiety or any type of negative feelings. We want our bed to be a place where our body knows it's time to shut down. If you ever find that sleep is overwhelming, you may take a short nap, but make sure it's no longer than 45 minutes, because then you get into issues with like feeling too sleepy afterwards. And you make sure it's between only 1 and 4, because you really want to make sure that you're not messing up your sleeps for later in the evening. One of the ways, like when I find I need to take a nap, if I don't want to sleep longer than 45 minutes, I'll just have a big tall glass of water, because then I know that I'm not going to be sleeping for a long time, because I'll be woken up on my bladder. So that is one tip. And then the other part of a sleep awareness or sleep therapy type program is maintaining a sleep diary. And the idea of maintaining a sleep diary is it allows you to personalize how much sleep and your bedtime that you should have, and gives a lot of insight into what may be an issue for your sleep. So there's some resources and good books to read. This program is based on a program I did with Queen's University. Sink into Sleep was written by Judith Davidson, and it's a really good book that offers the 6-step approach to helping you get a good night's sleep. There's another book called Quiet Your Mind and Go to Sleep, and another one called In the Insomnia Struggle. There's also some online resources and apps that you can get, but sinkintosleep.com or mysleepwell.ca are great resources online if you're looking for more information on sleep therapy programs or ways to calculate your own sleep efficiency and stuff. So if you'd like to connect with me, you could use the booking link bookmypharmacy.com/226-383-9461, and you book under Enhanced Pharmacy Care Services. It's under Insomnia Intake, and there's a free 15-minute consultation to see if it's a good fit for you. And the cost of 1-hour session is $120. Typically, it's a 6-step program, so there's 6 sessions in total, but you can tailor this based on your own needs. And lastly, I wanted to end this presentation with a breathing exercise to give you a tool to use in your toolbox to help you at home. So breathing is a good way to tap into our nervous systems. And this particular type of breathing is called 4-7-8 breathing. So it starts off by sitting in the world's best posture with your back straight. You want to make sure that your tip of your tongue is on the tissue just behind your upper front teeth, and you're going to keep your tongue there throughout the whole exercise. We're going to breathe out through our mouths. We're going to close our mouth, and we're going to breathe in through our nose while counting to 4. Then you're going to hold your breath and count to 7. And then you're going to breathe out through your mouth and count to 8. Good. We're going to repeat these steps 3 more times, and we want you to practice this exercise at least twice a day. The ratio of 4, 7, and 8 is important, and we want you to keep that ratio throughout the exercise. And if you find it's hard to hold your breath for 7 seconds, you can count faster, because we're not really looking for full seconds here. We're looking for 4 beats, basically. So whatever you want to breathe in, and then hold it for 7 seconds, or 7 beats, and then breathe it out for 8 beats. And like I said, that helps to calm our nervous system and help kind of ground you. So twice a day is what we recommend. So I'm now available for questions.
Okay. I will be adding the link and the email for those who want to connect with you. So maybe I can start some of these questions because of the number of questions I get on sleep that I think you possibly can give us a good answer to. So the first one is, what supplements can someone get to help with sleep? And this one is the one that I always get in the pharmacy and in the virtual visits that we have with people living with migraine coming for virtual consults. The first thing they ask me is, what supplement can I actually have to help me with migraine?
Oh, it's very fitting that these series is called Ask the Pharmacist. So what I would recommend is talking to your pharmacist to make sure that the medications or anything over the counter is good for you with the medications that you're on. Because I've had patients who have used medications over the counter and had ended up in hospital because it did not mesh with their medications, and they just figured it was safe because it was over the counter and they didn't need a prescription for it, and they were taking way too much, and it landed them in the hospital with serotonin syndrome. So I'll just preface this with that. Magnesium works great to help prevent migraines, but it can also help to relax our body before going to bed. It's important with magnesium that you increase the dose slowly, because it can relax our digestive systems before it relaxes our bodies and cause diarrhea. So we wouldn't want you to go too high on that. But magnesium is a good supplement for both, kind of two birds, one stone type thing, both migraines and insomnia. And then over the counter, some people will take melatonin, but again, it can affect some medications. So I'd really want you to check with your pharmacist to make sure it's right for you, because I wouldn't want you to take something that's not safe. The best thing, really and truly, for sleep is having a regular routine waking up time and a routine going to bed time. And the science behind it is so that you can sync up your circadian rhythm, which is a 24-hour cycle, with our sleep drive, which builds slowly throughout the day. So if you can sync up those two by having a regular time that you wake up in the morning and a regular time that you go to bed in the evening, then that can help to increase your chances of going to sleep without being frustrated.
So I have a question here. Is from I think Tushi is the name, and it says, I take melatonin along with magnesium. At what time in the evening should I take it? So now this is again, it's melatonin and magnesium.
Mm-hmm.
Myself, I don't start with melatonin, but if you're in melatonin and that does help with your sleep and it's not interacting with any of your medications, I do not usually stop it, continue to take it. But the question here is, what time in the evening should I be taking it so that it's effective in helping me with sleep?
Personally, I recommend a few hours before sleep taking the melatonin, and then the magnesium at least an hour before bed. You might have something different, or how do you recommend your magnesium for your migraine sufferers?
It depends. So magnesium can be taken all in one dose, and that's the next question: what form of magnesium is good for migraine? I know that with Migraine Canada, with the Canadian Headache Society, 2 forms of magnesium have been seen or have been studied enough to be in the guidelines, and these are magnesium citrate, and we do recommend magnesium citrate if you have constipation, because it does work on your bowels. It does relax the bowels, and it can help with constipation. Might give you diarrhea if you do not have constipation. So we do recommend citrate if you do have bowel issues that are in the form of constipation. If you have a sensitive stomach, no issue with bowel movement, then it's glycinate. The dose that we usually recommend is 600. I do agree with you, Rachel, that it's always a good idea to start with a lower dose. And I do say do it, at least make sure that you take it twice a day, just because of that effect it has on bowels. If you find that it doesn't change your bowel movement or does not have any complications, you can take it all in one go. Magnesium by itself has been showed in studies to help in abortive, it does have an abortive action on migraine. So dividing it to 2 or 3 times daily might actually help if you are in the middle of a migraine attack. It also helps if you have cramps around your period, if you
Mhm.
have menstrual cramps. That is a good way to actually divide it. I say take it with supper usually, only because with food is a good idea almost always. If there's nothing to prevent us from taking it with food, then I
Mhm.
always say take with food. Um, I do have one question here that says, I'm still not clear why migraine impacts sleep and other than due to pain.
Yeah, it is pain,
Okay.
right? If you're in pain, you're not going to sleep. Our little caveman brains are not made to sleep. If you were a caveman living eons ago and you had pain, that meant that you had to stay awake so that you could stay alive. So in this day and age, um, if you have pain, even though you're still safe, our caveman brain still makes you stay awake if you're in pain. That's why chronic pain is a perpetuating factor for insomnia, because our brains just don't shut down the same way when you're in chronic pain.
One of the things that I did read as well in answer to this is, I remember that sleep disruptions and sleep disturbances might be a trigger for migraine, but also they could be a premonitory symptom. And
Hmm.
that is, they are part of the evolution or of the actual cycle of migraine. There's a lot of there are a lot of changes in our brain that are related to the migraine attack. The migraine attack is not only your head pain, it might start 48 hours before, where you do see these interruptions in your sleep, that you see that some people get a little bit, they start yawning, for instance. That's a
Hmm.
premonitory symptom. And these are related to the condition itself and the way that there are changes in the neurotransmitters and also vascular changes that make our body react in a certain way. We're still not fully there in understanding why certain things happen with migraine.
Yeah, it's such an interesting thing. We're learning a lot more about migraine, but yeah, and certainly the other thing is that once a migraine is being treated, say with triptan or something, I find a lot of patients just go to sleep. So if you slept off your migraine the whole day, how are you going to expect to go to sleep that night, right? Because part of your rehabilitation was sleep. That's how you got over your migraine. But now, like, you're thrown off your rhythm of sleep. You've used up your sleep drive by taking a nap to get over the migraine. So now your body needs to build up that sleep drive again, and it's off kilter with the circadian rhythm. So you're going to have problems with sleep as a result of your migraine.
It's exactly what Jody McMillan is saying. She says, I find I usually can't sleep when I have a migraine. My medication makes me sleepy, plus, sleep helps get rid of the migraine.
Yeah,
Plays havoc on having a regular sleep schedule. Do you have
exactly.
any recommendations on how I can restart or regain good sleep hygiene after sleeping during the day with a migraine? And that is a very common complaint, is that we're telling ev- everybody, we're saying, make sure you have a good sleep hygiene. Do not undersleep or do not sleep too little or too much. With migraine does like a routine, does like that continuity and that
Mhm.
predictability, especially with sleep and sleep schedule. How can
I
how
think
can
that
we do
what you really need to do is give yourself grace. Like, yeah, you're going to have problems with sleep for a few days. Don't beat yourself up over it. You just got over a major migraine. Give yourself some grace. You're going to take a couple days and then you can get back onto your regular sleep schedule. But be kind to yourself. It's
I
normal
love
to have
this,
problems
Rach.
with sleep after a migraine.
I love this. This is absolutely what we need to always remind ourselves that, you've just gone through a really tough period of time. And
Mhm.
if it takes you a little bit longer to go into sleep or into a schedule, then be kind to yourself and accept that it might be challenging. But do we have any tips? Anything that might make it easier, you think?
To go to bed like that night, you probably are going to stay awake, but you need to make sure that you don't go to bed until you're actually tired. And that might be later than your regular bedtime, but try to wake up that same time in the morning because
And I
that same time in the morning time is really important.
And I really liked your idea that bed is only for sleeping. So if you're in bed, staying there for hours, just get out of bed. You know, go,
Mhm.
get out of bed. Do a cup of. That's what I think. Maybe a cup of chamomile
Yeah,
might help,
vitamin
or
D. Mhm.
valerian, or something that helps calm down your nerves. Do not drink coffee during the day if you have slept and you want to be able to sleep again. Do not drink coffee because that might make you more awake. Um, what else can we give as advice for Jody?
Make sure that the next day she probably will need to have a 45-minute nap because she'll probably be later staying up. She'll wake up at the same time that she would normally wake up and then take a nap plan for a nap between 1 and 4. And then the next night, try to go to bed at your regular time.
I hope I'm not missing some of your questions, but I will try to go back because I can see a lot of questions coming in. Um, the next question is, I am the big issue for me. That's Mary Rai. She says the big issue for me is that I'm in chronic pain and that
Yeah.
doesn't let me fall asleep. So even a regular routine doesn't help. Is there something safe to take nightly to reduce the pain enough so that I can sleep?
So, Mary, I don't know where you are in Canada. I'm not sure if you are in Ontario. I suffer from chronic pain. I also suffer from insomnia. And so there are chronic pain programs in a lot of different provinces that you may avail of to help you with chronic pain and thinking about the science of pain. And I could do a whole other thing on chronic pain. But basically, when you have chronic pain, a lot of treatment for insomnia and pain is about changing your mindset with pain. Um, and the programs kind of talk about the same thing that we talk about here tonight with insomnia and kind of knowing what you can control and what you can't control, and making sure that you have a regular routine, bedtime and nighttime. The other thing for chronic pain sufferers is making sure that you are able to be comfortable. So sometimes it's about like maybe you need extra pillows to support your body or support that painful part of you. Um, Maybe a hot bath before you go to bed with some Epsom salts to help relax your muscles before you go to sleep would be useful. Magnesium would be very good if you have a lot of muscle tightness because it can help with that as well. So, when you have chronic pain, there's a lot of work that you can do kind of like on your perception of your chronic pain that can be useful to help with um, acceptance and insomnia.
I'm sorry, I'm getting also some questions on text as well from some of our patients and listeners today. One of the questions I also got was around my pain medication and what I'm prescribed. Like if
Mhm.
I have more than one condition,
Yeah,
some of
which
these
goes.
medications make you sleepy, and
Mhm.
I'm supposed to take them more than once during the day. What do I do?
Try hard your hardest not to take a nap. And that may mean that you do something like do a puzzle, or you do Sudoku, or you go out for a walk after you take it so that you're using your body. It doesn't have to be a lot, like you don't have to go for like a 15-mile hike or anything. I'm just saying, if you walk around your block, if you can, with your pain, that can be useful. But medicine that makes you tired, that you take multiple times throughout the day, again, give yourself grace. You're going to be tired, and accept that you're going to be tired, and then come up with ways that you can keep your mind busy, so that you don't succumb to the napping. And the napping throughout the day is definitely going to give you problems with sleeping at night.
And unfortunately, a lot of the medications that we've had so far were not really designed for migraine. We've they were designed for other conditions. We have the new ones, but not everybody is on them. Not everybody can get them. Not everybody can afford them if they're not covered. So, does it become a matter of trade off? What are we trading off with these medications? Or is it controlling migraine, or is it there's a lot of trade-offs that people living with migraine have to
Yeah.
actually.
What's your Is the benefits of it outright outweighing the risks of having insomnia? Like, are you getting what you want out of that medication? And that's why having a good relationship with your community pharmacist is so important. And if you don't have a good relationship with your community pharmacist, find one that you can, because community pharmacists who know you and know your name and know what you're on are so important to the evolution of your care.
And I always get this question because I am specializing in migraine. I know you're also focused on these conditions where you are able to intervene and you're able to actually do more counseling than just the regular, some of these dispensing, different kind of pharmacy, um, let's say, practices. And I always get this question that my pharmacist doesn't know this, but
Then find another pharmacist.
not only this, but kind of enlist them. I would enlist my pharmacist if
Yeah.
I needed to. I would build that relationship and get them interested in learning more around my condition, and also learning more for other people who are living with a condition. I
Mhm.
learned most of what I know now by talking to people living with a condition. I've learned so much just because of the questions that we're getting, because
Mhm.
of the different people who are telling me. I've seen hundreds of patients. Not two are the same when it
No.
comes to migraine, interestingly enough. So
Yeah.
enlist your pharmacist. Find a pharmacist that will take interest in taking care of you, and they will spend the time and the effort.
Your
Canadian health.
pharmacist should know you by name. That's my thing. Your pharmacist should know you by name. They should know you when to walk in the door, and if they don't, then make sure they know you, and make sure you're unforgettable. And they'll learn ways. Like, pharmacists are like, we always have to do continuing education, and so if they get to know you and know your disease, then they should be helping you, and they will. That's just how pharmacists are.
I don't
Again.
know, Rachel, if you saw that we've just launched a Canada-wide training for pharmacists on migraine. It
Oh,
is
nice.
available at no cost. We have just launched it in around Christmas. Actually, it was our Christmas gift, and
Oh.
we are asking each and every pharmacist in Canada to go ahead, do this free training, and
Mhm.
get to learn more about migraine and how to support people living with migraine. So if you have a good relationship with your pharmacist, enlist them for us. Tell them, go and do some extra
Well, it's
training.
not for us. It's for you. Because the more they know, the more they'll be able to help you.
Exactly, exactly. You enlist them and they actually get to help you more. I have someone saying, I prefer independent pharmacies for this reason. Been going
Yeah,
to the same one for 26 years.
exactly.
All
Yes.
pharmacists want to help, all of them. When you're an independent, you possibly have um, different drivers than if you're working for a big organization that mandates what you do. I
Mhm.
I believe that all pharmacists want to help. Independent pharmacists get to choose what they do. I'm going to say.
Well, you get to choose how many people you have working with you, how much support you have. And when you work in corporate pharmacy, you don't have that flexibility and you don't have that support that you need to be able to support your patients sometimes in the fullest way.
So I have Kat asking, I'm taking another question around supplements as well. I'm
Mhm.
taking 200 milligram of bisglycinate, magnesium, 1 hour before bed. Should I be eating something light with it? I find if I don't, the next morning I have diarrhea. Am I taking the right type of magnesium for migraine prevention? Okay, that's an interesting question.
Hmm. It is an interesting question. It depends on what type of food that you're taking with it. Like, because if you're taking, like, say, a glass of milk with it, then you're likely not absorbing as much magnesium with that. It depends on what you're eating.
And is this the right type if she's having diarrhea?
No,
Okay.
right?
So what,
Like,
what should we be doing? Because glycinate is the one that is least causing diarrhea for people living with migraine.
I would decrease the dose.
Okay. Would you do it? Would you ask her to do it around lunch then, and see if there's a difference? Would you
But
ask her
you
to
wouldn't
take?
really be getting the benefit with sleep.
Okay.
So
Um,
she could probably do it at supper time, and then that's with more food, and it's closer to bedtime. But if she finds she gets too tired too quickly, then she could just move it a little bit later, and then have it with slice of toast or some crackers or something. Nothing with a lot of calcium.
okay. Um, but you already say I find if I don't eat it with something light, then I do have diarrhea. So I think you have your answer kind of right there in the question, because you know yourself best.
Hmm.
I wouldn't know how your body is better than you, and I don't think any of us can claim to know how your body reacts to certain things as you do. And that's Kat. I'm not sure how to say your last name, Kat. I'm really sorry. I'm gonna guess it's Chucks, but I'm not sure. Um, Someone asked me what is the name or the link to the training program for pharmacists. It is through the Ontario Pharmacists Association. It's called Mastermind, and this course I will try to find the link and I can put it in the comments. But it is at no charge, and it was developed with the Canadian Headache Society. Migraine Canada contributed to this, and we had another one that was done possibly a year or more ago that was for GPs, and this has been extended to pharmacists because of um, the interest that we have from pharmacists to help more people living with migraine. One more question that was, I think I saw something around REM sleep. Let me try and find that question. Can you speak about waking up and staying up? I can't fall asleep until late, and my REM probably kicks in a few hours before I wake up, and I hit snooze many times. So many questions in the same question. I don't know if
So the most important thing when it comes to sleep is having that time that you wake up be the same time. So you even if you put your alarm clock on in another room on the other side of the room, something that makes you get out of bed, because if you have a shifting sleep time, then your circadian rhythm is also shifting. So we want to make sure that those rhythms match up and are synchronized so that you have your circadian rhythm and your sleep drive working together to help you go to sleep at nighttime. And so the best thing you can do is have a rise time that's always consistent at the same time. Um, Having problems, what was the other question? Like falling, waking up or something, or having problems going to
be-
sleep?
because um, they can't wake up as well.
Yeah.
They are too tired to even wake up because they're not got, even though they're trying to sleep, they do not sleep early enough.
Yeah. So this slide where it talks about 6 steps to solid sleep, make sure you're practicing those, which is good hygiene, good sleep hygiene. So making sure that if you find you're going to sleep and you're frustrated with sleep and you're taking longer than 10 to 15 minutes, get up, Go read a book. Don't watch TV. Don't look at your phone. Don't go scrolling on the TikToks. Make sure that you're doing something that's not stimulating in that way to your brain. Um, put together a puzzle. Um, Fold socks. Anything that is going to help you only go to sleep once you're sleepy. And
And
then once you're asleep, once you have that done, like it takes about 2 or 3 weeks for your body to get used to this new routine because our bodies are really good and phenomenal at things like that. But if you practice those things and wake up at the same time, eventually over 2 or 3 weeks, you'll find that your body will allow and learn this new routine to allow you to get to sleep better.
what do you think about alcohol and sleep? Because a lot of people do drink or do have a glass of wine with dinner, and
Mhm.
they feel that it helps them sleep. Is
Mhm.
there anything that we know about alcohol and the effect on sleep?
Well, we know that if you have concomitant or you also have sleep apnea, along with everything else, that can affect sleep apnea and can make it worse. Um, in terms of specifically for sleep, it is not a recommended thing to help you sleep. It is not something that, uh, like the risks of drinking alcohol and being dependent upon alcohol to help you sleep does not give you the enough benefit. So it's not something that would be recommended.
Okay. I have a question. Another one is I don't wake up. That's Larissa Williams. She's saying, I don't wake up to my alarm next to me or on my wrist, let alone in another room. Is this related to the fatigue surrounding migraine?
It can be, but it could signal that if you haven't had a sleep study done, that you need to get a sleep study done. And that's something that you'd have to talk to your family doctor to arrange. And it can take some time to get in, but it's worthwhile to see what's going on with your sleep. Um,
And how can someone get a sleep study done?
so there's a screener that you can do called Stop Bang to see if you have if you are at a high risk for having sleep apnea. So
What is it called? Can we put it in the comments?
yeah, Stop Bang. Actually, if you
Let me
let me
see the comment section,
Stop
Rachel.
Bang questionnaire.
So it's a questionnaire that you actually fill, and based on it, you know if you need a sleep study.
Yeah. Yep. And it's like you get a point for, say, if you, so stop snoring, T, tired, O, observe. Has anybody ever observed you stop breathing, choking, or gasping for air during your sleep? If you're being treated for high blood pressure, or if you have high blood pressure, if you have a BMI over 35, if you're older than 50 years old, if you have a large neck size, so 17 inches for a male or 16 inches for a female, 43 centimeters, 41 centimeters, and if you have a male. So if you score anywhere from 3 and up, you have an intermediate to high risk of having obstructive sleep apnea, and it would qualify you for getting a sleep study, but that needs to be ordered by your family doctor. And you go to this clinic and they put all these wires on you and you go to sleep, and then they check your brain waves while you're sleeping and see how well you are able to get to sleep, how fast you can get to sleep, how much you sleep. And then a sleep doctor who's a specialist will look at your readings and then let you know what's going on with your sleep.
Okay, so other than sleep apnea, does a sleep study give us any other insights, any other conditions?
Oh yeah, it can. But uh, you can ask. Then you have access to a sleep doctor, so he can see how much REM sleep that you're getting, and he can see how deeply you're able to get to sleep. So it can give you some insight.
Okay. Larissa is saying that she doesn't fall into any of these categories. That's Larissa is the person who did um, ask the question, and no one can find an answer for time. Everyone makes it seem like it's so easy to change things, and that's what I hear all the time. But I feel like I've tried everything.
Yeah.
Um, And I hear this all the time. Like I hear it from patients all the time saying, I've tried everything. And
Mhm.
Rachel, is this why you've decided to have an actual program? Because
Yeah, yeah, that's why. Because people like if you talk to somebody who has chronic problems with sleep, they're going to know what sleep hygiene is. They're going to know all these steps. But this particular type of program breaks it into 6 steps. And again, there's that book that's available that's written by Judy. That's really useful. But the whole point of having this program is to gain some personal insight for the patient into their sleep. And if you don't give data, so if there is no sleep diary, then you can't really truly look in to see how you can help with the sleep. So sleep diaries are very important because you can look at and see where you can make improvements and changes.
so I have another question here. Thank you very much, Rachel. I have a question around anxiety and having a lot of anxiety. My anxiety surrounding migraine, that's Larissa. Larissa is saying my anxiety surrounding my migraines has gotten so severe that I'm afraid to go to sleep. I'm already going to therapy. I'm on anti-anxiety. She's asking if anyone else can relate to this, and I can see a lot of people are relating to this. But what about um, anxiety and sleep?
Yes, well, the circular thinking is a precipitating factor, generally being hyper aroused. All are precipitating to having or can help bring on this insomnia. Um, so, in a sleep therapy program, you're learning ways to help manage anxiety and look at your thoughts from like the outside and analyze your thoughts from the outside. Some of the things that you would do is like a thought dump. So if you're the type of person whose mind is just always going, have a little pad of paper, sit down, write out everything that you have that is bothering you or running through your mind. Just sketch out those little thoughts and put them down on a sheet of paper. And then look at those thoughts and categorize your thoughts into things that are in your control and things that are out of your control. And if they're out of your control, you're just going to have to release that from, just don't receive that negative energy. And if it's in your control, then make a plan to help tackle them.
What types of things should we track in a sleep diary?
Oh, so if you go to mysleepwell.ca, they have sleep PDF files of sleep diaries. Basically, you want to put down in your sleep diary when you wake up, how long you stayed in bed after you woke up. So if you're a lounger, like how long you spent. And then you want to also record if you took a nap throughout the day and how long you took a nap. And then in the evening time, you want to put down what time you went to bed and what time you think you fell asleep. And then if you woke up anytime during the night and how long it took you to go to sleep. So that way we can calculate how much sleep you had throughout a 24-hour period, and we can calculate your sleep efficiency.
And uh, you said that you can download it
Mm-hmm.
from,
Yeah,
is it, you said
mysleepwell.ca. They
my,
have under the resources. Yeah.
mysleepwell.ca. Okay.
Mhm.
Um, I also had a question that was not related to sleep, but I think is very valuable, the nausea.
Oh,
Because sometimes it's the nausea that affects sleep.
yes.
Um, the question is, what can I take to help with my nausea? What can help me with nausea?
So with nausea, having like the saltine crackers or goldfish crackers, like just little bits and sips of water or chewing on ice chips can be useful. Some people like ginger if you're looking for a natural root. The problem with taking grappa for nausea is that it has a side effect to help with sleep, but it gives very poor sleep quality.
Yeah.
So it will end up negatively affecting your sleep.
The
There's,
grogginess,
yeah,
right? It's that grogginess in the morning, like, is sometimes disabling. you feel like you're walking like a zombie.
Well,
After,
and like there's other side effects with it, like it can cause constipation, it can cause urinary retention, so feeling like you can't really let go of everything in your bladder and you pee, but you still feel like there's something in there. So I don't like Gravol as a drug for that reason, especially when it comes to sleep. For nausea, if you can have ginger ale, um, salty crackers, those types of things that can be useful. And as a last resort, you can take Gravol.
and you see, if you've just joined us or if you've been listening to us, you can see that pharmacists always want you to try natural things. But of course, if your nausea is at a level that is very difficult, that you're throwing up, your might it's also affecting the absorption of other medications, that you need to abort your migraine. There are prescription medications that have also been proved to help not only with your migraine headache, uh, but also with that nausea and with the absorption of other medications. So we're talking about things like metoclopramide, ondansetron. There's a whole bunch of them that is available by prescription, and we do encourage you, if your quality of life is affected by how nauseated you are, if you're really in a lot of discomfort, it's always a good idea to have a toolbox. Is a small box that you can pick and choose when you need something a little bit stronger than a ginger ale or ginger or whatever. You have it handy. You don't, it doesn't mean you have to take it every time, but when you've reached the point you really need something, then that's a good idea to have that. And if natural works best for you, continue with natural. I love ginger tea. I've just also discovered ginger drops that are a Canadian product and it tastes amazing. And I'm in love with this product, and it's available, not very expensive, and it does work, but it doesn't mean that it will work for everybody. Someone said, I keep rice cakes in the house when I want bland food. Yeah, rice cakes,
Mhm.
another good idea. They're easy and they do help. Someone said, Larissa asked again, would you know if the data gathered from an Apple Watch would help supplement a sleep diet?
It can, but how accurate that is, you don't know because it always needs to be in contact. I have a watch that also tracks my sleep, and I don't find it that accurate. So if you write it down, that would be the most accurate.
Is it like, I have a Fitbit that also looks at stages of sleep.
Mm-hmm.
And to start with, the first time I saw my readings, I was appalled. I was like, oh my God, there's something wrong with my, right? All this data, I wasn't able to really interpret it. But
Mm-hmm.
this time, I saw that there is a pattern, and you need the data over time to be able to see if there's a pattern and see if there's something that's happening um, when you're sleeping, how many times you wake up as well. Like if you wake up many times to use the washroom, that is an interruption in your sleep.
Yeah, and sometimes you need to see a pelvic floor therapist for help, or you need to take care of your bladder issue before you can help with your sleep.
Exactly. So that is another thing, is it's good to have these extra data collectors and sensors, but you need to be able to collect enough data and find a pattern that you can also address.
Yeah.
Because the idea, if it's data that I cannot utilize, I cannot do anything with it, it's really useless. um, any other questions? I see someone has said, I use a CPAP. Jody said, I use a CPAP, which helps my quality of sleep greatly. And that is specifically, sleep apnea is a big trigger for migraine and
Mhm.
might make migraine management very difficult, and might mean that the migraine or the headache symptoms that you have might be secondary to your sleep apnea as well,
Mhm.
right?
Yeah. And the thing with sleep apnea, when you have sleep apnea, is that it's a big contributor to inflammation in your body. And and it can affect your um, quality of pain. So, and decreases your pain threshold. So, you might just start to experience pain quicker than what would be typical because of the poor sleep. But the CPAP machine, if you can tolerate it, is great for sleep apnea treatment.
I have Melanie Owen Schneider asking us on any tips for dry mouth as a side effect from certain migraine meds.
Yeah. So anytime that you can see lemons, even if you have a picture of a lemon, even if you have lemons in a bowl, even me just talking about lemons causes my salivary glands to like respond. So that can be useful. Any type of gum that has xylitol in it, or even now they have lozenges and you can get a dry mouth spray. You can even get a dry mouth gel. So at the height of my dry mouth problems due to chronic pain, then the gel worked really well to help keep my mouth moisturized. The only problem with xylitol stuff is that if you have an animal, make sure the animals will get it because xylitol is can be very dangerous and toxic to dogs. But yeah, those things are great, all great for dry mouth. Um, I don't know if you have anything else to add.
Small sips of water,
Yeah, yes, yeah.
double win. We need to ensure that we're very well hydrated. So small sips of water, keep a glass of water next to you, next to your bedstand. If you feel that you have dry mouth, take small, you can't have gum in the middle of the night, but a small sip of water at night might help.
Or
um,
having the spray next to your body.
or that's another option. So xyli melts. Jody said my dentist recommended xyli melts. So anything that has xylitol. I know there's even the toothpaste
Yeah.
that
Mhm.
does have the same ingredient, and that does help with dry mouth. So if you brush your teeth before you go to sleep, using this the spray. um, the other thing is, as you said, is just think of lemons. Just talking about lemons now, I can't I can't say things right. But the other thing that I always say is, a medication that gives you a side effect, is it tolerable? Is it working? Can you reduce the dose? Because sometimes you're on the dose for so long that we don't know if it's the right dose, or if you're okay to reduce a little bit and see if that gets better. um, that's one of the things. That's not what we go for first, but just to keep in mind that maybe the dose is something that you can have a discussion with your doctor. What happens if I reduce the dose a little bit? Do I still get control but less of the side effect? And that's a general rule for all medications. If you're on a medication and you're getting side effects, maybe it's time to see what happens if I reduce the dose. Do I still get the same results but less of the side effect? What do you think, Rachel? Or is this too early to say?
No, no, no. I think that it's always good to reevaluate medications and whether they're needed and if the doses are appropriate.
Okay. I think we have a couple of minutes, and I didn't want to have this as the last thing to ask, but what about when nothing else works and someone needs um, a prescribed sleeping pill? What do you think of that?
So there are some medications, they're all meant to be used short term. There's prescription medications like Imovane and Davago that can be used to help sleep. Again, we always would recommend that you try these non drug measures to help with sleep and give yourself grace to really give a college try to them. Um, Research shows on mysleepwell.ca, they have a PDF where it can compares a sleep therapy program with taking medications and the pros and cons of both. And it's a good reminder of why these types of programs are so effective without having the side effects.
Okay. Um, we're almost at time. It's almost like 45 seconds, I think, is all I have. I would like to thank Rachel for the amazing information that she gave us. I will put in the chat I'm going to try and put the information for you to contact her. Hoping to see you next time. Thank you very much, Rachel. You can book with Rachel. She does have a virtual service if you need to get, um, advice on your sleep or to book for a consult. She does provide the first 15 minutes free, so take full advantage, talk to her, see if this is something that you're interested in doing. We are also still offering migraine consults online. I'm also going to put that in the private chat where we do have the virtual. I do see you on virtual consults, so also if you do need to get a consult for your migraine with a pharmacist, Rachel does this, but I also do this virtually, and I'm putting this in our comments. The last thing I wanted to tell you, someone asked me about the migraine link. I will also, or the migraine training for pharmacists link, I will put this also in our chat. Thank you very much for joining us tonight. I hope you stay warm and safe, and I hope that we were able to answer your questions. Rachel, I wish you all the luck, and I hope that you continue to take care of people living with migraine, and now also sleepless people living with migraine.
Mhm.
And all the best. Thank you very much. And thank you, Migraine Canada, for giving us the opportunity to share all this knowledge with people living with migraine. Thank you.
Thank you.